Today we're going to talk about the scope of practice for nurse practitioners in Kansas. In Kansas, it is a full practice state, so these nurse practitioners can perform at their highest education and training with autonomy. The Kansas Bill 2279 was passed in 2022 that required collaborative practice agreements with physicians and maintain prescribing protocols, which helps in aiding that nurse practitioners have this full scope of practice per the Kansas Medical Society. They're allowed to make independent decisions, prescribe controlled substances, and also medical equipment as well. However, there is a little bit of a gray area when it comes to being a primary care provider, as well as if they have the actual control to admit someone to the hospital. Other legal barriers and regulatory actions that states face on the federal and institutional levels include health systems have the authority to decide if a nurse practitioner has their full scope of practice or not and what privileges they have in that facility. So they may still require physician signature. Furthermore, a survey found that many states still require signatures by physicians to go across state lines, even if that state has full practice autonomy for nurse practitioners. Medicare also has restrictions where certain scenarios like home health or medical equipment require physician signatures, and this is more of a legality thing, and certain billing issues that require the physician signature even though the nurse practitioner practices with full authority in Kansas. To help remove some of these barriers, it's important that the Kansas Nurse Practice Act ensures that nurse practitioners have the authority to perform as primary care providers, which will also help in rural settings to help serve that population. Also, it will help with admissions to the hospital if they do have that authority, clarifying what scope of practice they really do have. Furthermore, medical decisions should be more clearly defined with stating like primary care provider or ability to admit to a hospital. This ensures that there's no like interpretation from people or health systems that then can deny this transfer or this admission. Furthermore, then we can implement these trials into the practice and have projects to kind of oversee and review them like any other thing we do and make sure there's compliance with these regulations. Thanks.